And the key thing is that when we talk about imaging data, not only do you need experts in terms of acquiring the data, but you need a tremendous amount of expertise in analyzing that data. And traditionally, what's happened in many of these large-scale multinational studies is that data is collected in sub-Saharan Africa or Asia areas, and then that data is transferred back to some central processing center, usually at a US-based institution, who undertakes all the image analysis, does all the QA, QC, runs all the post-processing, and then feeds that information potentially back to the investigators at those sub-Saharan sites, who then can write the papers. That's the best case. The worst case is that those universities might take credit for that data and they ultimately write the papers. But we didn't want to take that approach here. We really wanted to make sure that we were building the capacity to do that analysis, to understand the data that's being acquired, and really set those sites up to be able to take the lead on a lot of these projects and a lot of that analysis. But the challenge there is obviously that in order to do a lot of the imaging analysis that we have requires a pretty substantial amount of infrastructure, both on the computational side, but again, on that knowledge side. So how can we lower that burden? And this is really where the relationship with Flywheel came from, was that rather than trying to set up these large-scale image processing laboratories, do all the capacity building in terms of the infrastructure as well as training, we could instead offload a lot of that to the cloud, as it were, to Flywheel, to act as our cloud-based image curation and analysis suite, and then focus our time initially on building the capacity on the personnel, helping them learn what image processing looks like, what data looks like, how to process it, how to manipulate it, how to build their own processing tools, really get a deep understanding of what that work is like. And then once that's kind of built on, then we can move on to building that capacity in terms of the infrastructure. But Flywheel really acted as a nice, direct, easy way to integrate across all of these sites, have a singular place where we can bring that data, bring it together, ensure that it's searchable and shareable across our network, but also that we can harmonize data processing pipelines so that we know everyone's doing the same thing. So it's easy to integrate that data back together again, but also build that capacity early on, really lower that bar to training on what image analysis really looks like before really bringing all those sites up to speed. And so this is, again, really kind of thinking from the beginning steps of really trying to optimize child health all the way down to collecting that data, harmonizing that data, and then building capacities at these individual sites so they can take this work on once we're done.